environmental safety. Yes? Cool. One patient. I'm assessing for a mechanism of injury. Do I see one? Where am I at? What's going on?
There's a parachute over there.
Okay.
You are in a field and you see a parachute.
So I'm in a field and there's a parachute and a person laying here on the floor.
That's correct.
All right. Sounds good. It appears that there's a mechanism of injury. Okay? Okay, I'm going to call the appropriate resources. Right now I've got myself, my partner, my other partner, my other partner, and my last partner. Cool? Sound good? I determined that there's a need for C-spine. So partner, would you mind holding C-spine on this person for me?
Sure.
Hold inline stabilization and don't let go until I tell you.
I know it's not professional, but
We've been here before, Michael.
yep, I know.
Great.
Remember I was drunk? On the stairs.
Okay.
That's why I know your head so well.
So, formulating a general impression. I see a guy. How old are you? 22?
21.
Said this before. He's in his early 20s. He's like supine. His eyes are open. And he's looking at my partner. So he appears to be tracking.
Oh, I'm Michael, by the way.
Alright.
That's great.
Hey.
Okay. As I'm walking up to this person, do I determine any particular life threats or any hemorrhaging that I can see spurting out in any direction?
You see a spurting arterial bleed in the brachial artery.
In the brachial artery. Left or right?
Right.
Right? Okay. Well, partner, I'm gonna need this box over here that your phone's resting on. Just go ahead and bring that over here. And this is a very obvious spurting arterial bleed that's happening. Okay, that goes somehow in that direction. Go ahead and hand me some 4x4 gauze, please. Okay, that works. Just hand me that whole pack. I'll take both of them. Give me a whole stack of them. Thank you. Great. Cool. Great. Okay. I'm gonna hold direct pressure on this wound. Okay?
Toss it on the knees.
Do we have more gauze? Give me something that'll work. I don't think this will work. This petroleum gauze. Those two you just pulled out will work. That won't. You just whatever you think. Great. How's my direct pressure going?
It's going great. Bleeding is controlled.
Bleeding's controlled. That's convenient.
Do you want it to not be controlled?
Yeah.
Tourniquet it?
Let's tourniquet it. Why not?
No, bleeding is not controlled.
Gary, can you hand me a tourniquet, please? Great. And then Gary, come here. I need you to come over to this side. Okay. I need you to hold direct pressure. Good. Yeah, just hold direct pressure. Great. Cool. Okay, going at least 2 inches above, as high as I can go. I'll tighten as far as I can, and I'm gonna put this in this little saddle, and then write the time down. And I did it. I'm also gonna make sure bleeding is controlled and that I have no distal pulses. Okay? Cool. Alright, Gary, I'm gonna put you on bandage duty, so I'm gonna hand you a bandage, and you bandage that up from here, okay? Great. Hey, man.
Hey,
What's your name?
Brian.
Brian. How old are you?
21.
What year is it?
2021.
Okay. What city are we in?
Santee.
Santee. What's going on, man? What happened?
I jumped out of the sky and my chute didn't deploy.
Your chute didn't deploy, and now here you are, oriented times 4. That's incredible. All right, man.
That's what they said.
Fully deployed.
Yeah.
They're fully deployed. I just said it's too fast.
Okay. Is anything bothering you? Does what hurts the most right now?
My back.
Your back hurts the most. Okay. All right. So Brian's 21. He's oriented ×4. He's complaining of back pain. He experienced a pretty serious mechanism of injury. We're holding C-spine. We controlled his bleeding. Any other life-threatening bleeding that I can notice just by looking at Brian? No. Okay. I know Brian's airway is pain to maintainable because he's speaking to me in full and complete sentences. Breathing appears to be adequate. I'm going to put on a stethoscope, and I don't got one. I'll take a quick listen, see if there's any problems with breathing. Got a good tidal volume. Okay. Do I notice any abnormalities with breathing?
Lung sounds are clear on all fields.
Okay. I've got an O2 sat on this finger, just in case. It's going to be tough to do that with a trauma patient, so we won't say it's going to be happening all the time. He was bleeding significantly, so we got to put an under breather on this person. All right? So, partner, can you grab me an under breather, please, and set it at 15 liters and put it on this person's face? That's great. Really?
How are we gonna put it
We're not. It's dirty.
You're going to have to figure it out.
The thing doesn't touch.
Yep, just put on an under breather.
No, it's like
Just put it across his chest, okay?
restrictive.
Circulation. I'm checking a pulse in the extremity that doesn't have a tourniquet on it. I feel a strong and regular radial pulse. Is that what I feel?
Yes.
Strong, regular radial pulse?
Yeah.
Skins are pink, warm, and dry?
Sure. Yes.
Post fountaining arterial bleed on the right arm and falling out of the sky. He's got a strong and regular radial pulse, and he's got pink, warm, and dry skins.
Let's do.
That's incredible. Okay. We've got an under breather on, treating for shock. I'm gonna real quick do a blood sweep. So let me just checking for bleeding. Okay. Any bleeding on the torso I can't see? Arm, this, pelvis, nothing. Okay, blood sweep's done. Okay. Well, I definitely want to prioritize and transport this patient. So we're gonna have to get this person on a backboard, alright? Partner, will you grab me this backboard stuff? Meanwhile, hey man, let me see your arms here. Get rid of that one, you probably can't move super well. That's great. No pulses. Can you wiggle your fingers on this arm? Can you feel which finger I'm touching?
There's a tourniquet on my arm.
Yeah. Can you feel it?
Yes.
Okay, great.
I didn't know if that'd be possible.
I got a pulse in the left hand too. Great. What finger am I touching?
My index finger.
Okay, cool. Wiggle your fingers for me. Perfect. All right. Wiggle your toes. Which toe am I touching?
The big one.
On which side?
My left side.
Okay, what about now?
My right side, big one.
Okay, sounds good. Cool. Checking pulses. I've actually got some strong pulses. So that's good. So the only one that's got any problems is the side that has a tourniquet on it. No worries. Okay. PMS is done. I'm going to check the back of the neck, see if there's any decap E2 left prior to putting this collar on. Right on? It feels clear. I'm going to measure his neck. Yeah, he's got like a 3-finger neck. That's good enough. Alright. Slide this under. How you doing there, buddy? Is that alright?
Yes.
Okay, sounds good. Alright. Let's go ahead and get the backboard over here. Perfect. Other partner, I need your help as well. Okay. Let's actually switch sides so we're not rolling onto the extremity that's got the tourniquet.
Is it really? Oh, I was about to say.
All right.
Fine.
Yep. Okay. I'm gonna grab here at the shoulder. My partner over there is gonna grab exactly. Okay, and then on the heads count, we're gonna roll up in our direction.
On 3. 1, 2, 3.
Okay. I'm going to check the back for any decap VTLS, any secondary trauma or any issues. I'm checking the buttocks and I'm looking at the back of the legs. Do I notice any trauma?
You notice step off.
You notice a step off. Okay. Where?
Mid back.
Okay. Noted. Let's go ahead and scoop that under here. Great. Now we're gonna roll down on the count of the head.
On 3. 1, 2, 3.
Great. That was absolutely terrible. Okay, so here's the deal. Let me lift it. We're gonna lift you back up. Count of the head.
On 3. 1, 2, 3.
Okay, Thomas, put the board under him. There you go. And then when we go down, I need you to scoop him like a big scoop of ice cream. We know you can do it, buddy. Ready?
On 3. 1, 2, 3.
Okay, a little bit better. We're gonna go down and to the right. Here's the deal, the board likes to move, so put a foot on it or something, okay? Thomas, I need you to grab at the hip and the shoulder. Okay, and we're moving on the count, and we need to do it like big men, okay? We're gonna do it on the count of the head.
On 3. 1, 2, 3.
Perfect. Now we're gonna go back up another 6 inches on the count of the head.
On 3. 1, 2, 3.
Great. Cool. Let's strap down the torso.
Like a feather.
I'm gonna need my partner to lift up the feet here. Lift up the foot of the, go down there with good lifting technique. Great. Lift up. Pull out the belts. Pull out all the belts. You can set it back down. Great. Arms up real quick for me. Thank you. Okay. Deep breath in. Okay. Okay, you can let it out. Perfect. Okay. Those are on. I need some head blocks. Gary, can you give me some head blocks, please? Oh, Gary.
Some head block.
Oh. They're right back? Okay. That's perfect. Okay. Go ahead and feather your hand up for me here. Right above the ear. Perfect. Okay. Same thing for this side. Perfect. Strap over here. Strap coming down here. Perfect. Piece of tape. This side of the board to this side of the board. Piece of tape. Same spot on the board, across the neck, over to this side of the board. Okay. Now we're done with C-spine skill. My partner can let go of the head. Hey man, lift your fingers to me again. What finger am I touching? What finger am I touching? Checking for pulses. I got no pulse on the hand. It's got the tourniquet. We're just assuming. Okay? We got pulses in the left hand. Great. Okay, look at your toes for me. Okay. What toe am I touching?
My big one on my
Okay.
left side.
What toe am I touching?
My little one on my right side.
Okay. Checking pulses. Okay, PMS is done. We're in the back of the ambulance now. Alright?
Can we just say that?
Sure. We're in the back of the ambulance, we're driving. Brian, you got any other signs or symptoms going on? Are you nauseous? Do you have a headache? Do you have anything else going on that you need to tell me about? Complaints?
No.
Okay, any allergies?
No.
You take any medications for anything? Meanwhile, I'm sorry, they actually switched it. They want you to see vitals first, right?
Mm-hmm.
Okay, so, partner, can you give me a blood pressure on this arm that doesn't have a tourniquet on it?
Get your blood pressure.
Great. Can you give me a respiratory rate? And let's put a pulse ox on this person, get a heart rate. Okay? Sweet. So that's going on. Any allergies?
No.
You take any medications?
No.
Okay. What's your past medical history look like?
None.
No past medical history?
No.
Okay, what's the last thing you had to eat?
Burger.
Okay, and you just jumped out the plane and now you're on the ground?
Mm-hmm.
Okay, sounds good. I'm gonna start doing a secondary assessment. All my partners are already getting vital signs, okay? So I'm checking for decap BTLS. I'm looking in the head. Looking for blood, feeling for any instability. I don't notice any. Looking in the ears for any blood or CSF in the ears. Checking the size of the face. They're stable. Face bones look stable. Looking in the eyes with a pen light, making sure pupils are pearl. Are pupils pearl? Yes? Okay.
Yes.
Looking in the nose. No abnormalities. Open your mouth for me. Looking for any trauma in the mouth. Okay. Jaws intact, stable. Great. Front of the neck, any tracheal deviation or JVD.
No.
Looking for subcutaneous emphysema. Checking the clavicles. They seem to be stable. Feeling down the sternum. Sternum is good. Already checked lung sounds earlier. Okay, checking the size of the chest. Okay, go ahead and put your arms down your side for me. Checking the chest here. Okay. Chest stable?
Yes.
Chest is stable. Okay. Don't notice any other injuries on the chest?
No.
Okay. Checking the abdomen. Do you have any pain in your abdomen?
No.
Okay. I'm checking your abdomen, rolling all 4 quadrants. Do I notice any abnormalities, any distension or rigidity?
You notice stomach distension.
Stomach distension. Okay, any bruising?
Yes.
Okay. And you're not having any pain in your abdomen?
No.
Word. Okay. Nothing hanging out of his abdomen, no openings anywhere.
No.
Okay, checking the pelvis. Excuse me. Okay, pressing down, pressing in. Pelvis is stable. Checking for priapism. Nothing?
Pelvis is unstable.
Okay,
Decrepit as present.
pelvis is unstable. Let's get a pelvic binder. It's back there in that back closet. Should be. Unless it's over here. Someone go look over there. So we're getting a pelvic binder. Okay, offsetting pressures through the legs. Top, left femur, good. Left lower leg, good. Checking right femur, good. Right lower leg, good. Joints, good. Feet, good. Right on. We got a pelvic binder. That's nice. Somebody come here and help me with this.
The patient on the spine.
Go ahead, pull it through. Great. We're going to shimmy it down. Help me shimmy on that side. Gotta shimmy it. Back and forth. Get under that ass. There it is. Okay, great. We're gonna bind your pelvis now. Pelvis binded. Is that binding your pelvis okay? Great. All right. Checking the arms. Offsetting pressures. Nothing?
The patient winces in pain and there's a deformity to the arm.
Deformity to which part of the arm?
The forearm.
The left forearm. All right. Partner, come here. Hold his arm stable. Checking the right arm again. Anything? How's the bleeding doing with this? Is it still controlled?
Yes.
Checking the right arm. Any abnormalities?
No.
No? Okay. All right. PMS is good in the left arm, but I'll check it again. We're about to do a split. Okay? Gary, you want to check the PMS in that left hand for me?
Yep.
Thanks.
Feel a strong radial pulse.
Okay.
Which finger am I touching?
This one.
Can you wiggle your finger, all your fingers for me?
Yeah.
Okay, PMS is done.
That's great.
Cool.
Let's go ahead and split this in a position of function if we can. Are we able to manipulate the arm across his chest without any problems?
Yes.
Okay. That's great. Alright. You just hold that nice and tight for me, buddy. Okay, forearm fracture. I'm gonna use this splint. Okay. We would normally measure with the other arm, but his other arm's got a tourniquet on it and has a bunch of stuff going on, so I'm just not gonna even worry about it, alright? Okay, cool. Keep hold of his arm in a good spot. Ooh. Great. What do I have to immobilize if I immobilize his forearm for a forearm
Joint
fracture?
above and
Yeah,
below.
joints above and below.
Okay, this is a massive freaking roller thing of ace right here. But whatever. Okay, partner. We're gonna wrap this up. Okay. Let's do one through the finger. Okay. Let's roll it up. Distal to proximal. You know what? Give me an ice pack. Throw it in. Why not? Great. Thank you, sir. It's a long ass thing I've got. Great. Ice pack, you're going right here, buddy. Why not? Boom.
You wanna put a sling on that or not?
Now he's laying on the ground, so it's fine. So now let's find a good position of function. Wrist arm. That works. Great. So now that's done. We're gonna do PMS. Look at your fingers for me real quick. What finger am I touching? That one. Great. Alright, man. Let me check your pulse real fast. Okay. Pulse are present. Great. PMS is good before and after. Alright. That concludes my secondary assessment. Let's put a blanket on this guy. Cool? Oh, would you look at that? Gary's already prepped, dude. Love it. So we got a blanket on, so he stays nice and warm. And we're gonna reassess vital signs and injury sites at least every 5 minutes. All right. Anything else? Is that it?
Yep.
The whole thing? Okay. Did I miss anything? All right. Sweet.